Well, we are live. Hello, everyone. Happy Monday. It's almost Christmas, almost holiday. So we are here with Kate Broadwell. She's going to introduce herself from Wake County. Hi, Kate. How are you?
Hi, I'm doing well. How are you?
I'm good. I'm good. Looking forward for Christmas, for the holidays, and excited about having you here because my name is Ivania Gutierrez. I am the Executive Director of Connecting Community, and we do these interviews of different service providers that are in North Carolina. In this case, is Wake County. So we invite Kate, who represent this program, Health Lead for Wake County, and they have amazing things for the community. So that's why we want to do this interview is in English. So we're going to have another one that I'm going to translate to Spanish. So si tú hablas español, va a ser más fácil que veas la que viene después. In maybe 20 minutes, we're going to be live with the one translated to Spanish. But this one in particular is in English. So hello, Kate, please introduce yourself and let us know, what is Wake County Health and Human Service Department. If you can describe a little bit more about the Healthy for Wake program
Mhm.
that is part of it, that will be amazing.
Sure. Well, thank you for having me. I really appreciate it. And my name's Kate. I'm the health educator with the Health Lit for Wake program. Health Lit for Wake is a small grant-funded program within Wake County, Wake County's population health unit. Population health is when within Health and Human Services. So there's kind of a tier, it gets bigger and bigger. Health and Human Services, contains all the different programs and units involving, health, human resources in Wake County, everything from environmental health to our unit population health, which includes teams focused on health promotion like HIV, STD prevention and awareness, our smaller program, safe routes to school. There's a lot that it encompasses. And then, of course, also within Health and Human Services, there's actual clinics. So within Wake County, there's clinics kind of spread throughout Wake County where you can get a lot of different health services. Testing, screenings, vaccines, well child checks, all of that, very all-encompassing. But yeah, Health Lit for Wake is just a small program kind of within population health, and we are focused largely on health literacy and health equity focused work. In the past, the way the program started was kind of at the height of COVID-19. So we were funded to address specifically vaccine disparities or vaccine hesitancy and then health disparities that were kind of impacted by coronavirus and focusing on the communities and populations that were most affected by COVID-19. So that's how we came about. And then as our program has evolved, and our grant funding source has changed, now we focus more broadly on health equity and health literacy.
So what programs how many programs are you going to talk about? What are your most popular? I've seen the Ask the Doctor, which I think is pretty cool, where community get together and a doctor present different topics. And that's what I was like a very interested to present this Ask the Doctor. So there is other programs that you want to also talk about, or you want to start with this one? I don't know how you want to structure this.
Yeah, sure. Well, Ask the Doc is a good place to start because that's kind of my wheelhouse as the health educator. So since one of the big components of Health Lit for Wake is health literacy, we have a couple programs. Ask the Doc is one of our longest standing kind of initiatives that we've done since Health Lit for Wake started. And what it is an opportunity for community members to get free health information by listening to a panel of medical experts.
How often do you do this, Kate? The Ask the Doctor is every month.
We do it every quarter, so about every 3 to 4 months. And the topics always change out. So depending on what we're hearing in the community, topics that are in demand, depending on what we're seeing, like if there's higher COVID or flu numbers, that might be something we focus on. And it started again, in the midst of the pandemic. So it was very COVID focused. It started as a way to get like the most in demand questions answered out to the community. And then since we've gone along, we've expanded that to cover a lot of different topics. So we always almost touch on COVID-19, but we've now covered things like mental health and vaping, tobacco cessation, preventative health.
How do you know what topics people? Maybe it's a good question to ask to people who are seeing us. It would be nice to know from people who are listening at what are the topics that, because I've heard a lot of need to get connected with mental health resources, but maybe informationally, maybe people who is listening at they will say, oh, you know what, I would love to hear about dental health, or I would love to hear about, I don't know, that how do you go to the community and ask who they want to be here, or who are the professionals that people want to more listen from?
Yeah, it kind of comes about in different ways each quarter. I mean, ideally, we're getting requests for topics directly from the community. So, for example, most recently, we did an Ask the Doc with St. Paul AME Church, which is one of the oldest churches in downtown Raleigh. And they wanted chronic disease prevention information and preventative healthcare information. And so we did that for them. Other times, maybe there's a topic we want to highlight because maybe, for example, it's October and it's Breast Cancer Awareness Month. So we could talk about, screenings for breast cancer and tie in other, other types of screenings that are important for different, age groups. And then other times it comes from, and I'll talk about this later, but we have work groups and we have our Health Equity Coalition. So there's ways that the community, in terms of community organizations like Connecting Community, can have input and say, we're hearing a lot of people talk about this issue, or I know a contact who would be really excited to share information on this. Like I know a doctor who would be really excited to talk about this. So then sometimes it comes about more organically that way.
It makes sense because it's also about the networking, right? That you do.
Yeah.
So do you have a schedule already, the next Ask the Doctor, or not yet?
Not quite. So we just finished up this recent quarter's Ask the Doc. Actually, last week we had our Spanish Ask the Doc at the Mexican consulate, and then a couple weeks before that we had the English one I was talking about at St. Paul Church.
So where people we're gonna leave all the information, I know, but people are we're gonna do the links. So maybe there is a link that people can be checking when is the next Ask the Doctor, and they can find out, right?
Yes, we have our webpage. So I would love to share that with you. So people
we're going to leave everything after the interview for everybody. So if you are also listening and you have questions, please put your questions, and you can get the question answered, and also share if you think this information can be beneficial for another person, right? So that's important too. So what other programs, Kate, do you want to talk about today?
Well, I covered Ask the Doc, so that's done. But there's more health education efforts. So something again that I do is organize smaller health education trainings and workshops. So one I've done recently that I'm hoping to continue and get kind of input on and collaborate with organizations on is our boot camps. And I've done that around COVID-19, flu, and cold prevention. So talking about kind of the most up-to-date guidance around COVID and testing. Now people are kind of getting more tired of talking about COVID. So it's a challenge to evolve to get important health information to the community, but maybe it's not something that is as in demand, these days. So yeah, I would say these trainings, they're an hour long typically, and I'm open to collaboration on really any topic. So, I could bring a doctor in and we could go into different community spaces and do smaller trainings.
So this
Um,
is a call for other organizations as well that they
mhm.
might be interested to host something like that. So if you know an organization or you're part of volunteer for an organization, let them know that Kate is open to collaborate to do these boot camps about that topic, right?
Yes, we love collaboration.
We love
Collaboration
collaboration
is
too, so we are on the same
yeah.
page. I think it's actually look what my cap says, stronger together. So we
Mhm.
definitely think that collaborating is the way. So I'm
Yeah.
excited to, for if you can find partners through this, channel that we're opening, that's great. So um where that's for the programs, right? How can someone get involved in Held It for Wake? How can people contact you, or what do you need collaboration? And we talk about agencies to host a topic
Yeah.
informational, but what other ways people can get involved?
Mhm. Yeah, I would say there's numerous ways. I mean, Health Fit for Wake largely we are trying to build bridges. We want to have a coalition of many partners and facilitate health literacy and health equity initiatives that way. So there's a couple ways to get involved. Um, the first way is everything I just mentioned is all our health education efforts. We really ideally would love every time to have someone say, we want to work with you and we have this idea and we have this topic we're passionate about. And then we kind of facilitate the resources and the connections to do that. So, knowing like our services and then connecting with us, and we're always open to collaborating with folks that way. And then the second way to kind of just be in the Health Fit for Wake network is through our work groups. So we have 5 work groups that meet typically every month. There's a few that meet on a quarterly basis, but we have work groups around different topics. So we have a policy and sustainability work group. There's a community outreach work group, which I co-lead. There's a communications work group, and then there's our greater health equity coalition, which is just kind of free for all. Anyone who's a partner of ours can come to those meetings. So joining a work group is a great way to hear about what Health for Wake is doing, to hear what other organizations in Wake County are doing, and just collaborate that way. So I would say those two things,
So
reaching
we
out.
are doing a call for organization and also for community leaders or people who want to be involved in these work
Mhm.
groups.
Yeah.
Okay.
Yeah, we have people representing like Wake Med, and we have other people within Wake County internally who join those meetings. We also have people who are, kind of one person shows, like they have their own organization and they're community advocates and they join, and we all connect that way. And most of those are virtual, I should say, but we do have like we just had our annual in-person um, health equity coalition meeting.
And we're going to leave your email. What's the best way to contact you about that? Through your email, or what is the
Yeah,
best?
you could email me, but also I'll link the web page. Our web page has all of the descriptions of work
Okay.
groups,
We
so
can
you
leave
can
that. We can
find out
leave that.
find out more information about what they are, and then you can reach out to me and I can send you the link to join.
Perfect. Perfect. No, the best way to contact, that's the one we're going to leave in the body of our post. So I think we pretty much cover everything. Where is it located? Open hour, you said is more like a virtual, so it's all everything is going to be in the link, right?
Yes, yeah, our web page is kind of where we house all the main components of our program and who we are. Um, there's one other program I wanted to mention that I think is important to know, which is our mini grant program. So for the past couple of years, Health Lit for Wake has kind of overseen a mini grant program that provides an opportunity for organizations in Wake County focused on, again, health literacy and health education efforts to apply and get funding. It's a mini grant, so it's not like a huge sum of money, but it's often enough to start, an initiative or support a new hiree, or there's many ways you could use the funds. But that is something that goes on every year, and we've just kind of started our new round. So the application isn't open, but it will be open later in the year, and you can find more information about that as well on our webpage. So that's kind of one other way to get involved.
Yeah, that's great. And actually, I kind of missed that, but I'm gonna apply next
Yeah.
year. But it's important for organizations like ours that are starting and they have a good heart for the community and they need resources. So thank you for mentioning that as well. I think we are gonna wrapping up this interview because we have another one in Spanish. If people has more questions, please reach out to Kate. We're gonna leave everything after these couple of hours. We're gonna edit the post and everything is gonna be there. And thank you, Kate, for coming and talk about these amazing programs. I love the Ask the Doctor. I love the initiative of the boot camp and everything that implies to educate us more about our health and not only physical health, but also mental health and ways that we can, improve our quality of life is beautiful things to do. So thank you for that. Muchas gracias. And
Yeah.
for people who speak Spanish and they're listening, we are in maybe 10 minutes. We're coming back. I'm going to translate everything that Kate said to Spanish. So that's also something that Connecting Community likes to do, that language, especially Spanish, shouldn't be a barrier. So we're going to make it accessible for people who prefer, that we speak in Spanish. So see you soon. And thank you for joining us, Kate, today. And I hope that you have a Merry Christmas and a wonderful holidays.
Thank you. Thanks for the opportunity, and thanks to everyone tuning in.
Thank you.